So I have taken the fried chicken off the table. Okay. Breathe. Rosalind Brock is one of the wonderful new voices that have emerged. She's the vice chair of the NAACP. I had the privilege, give us some love over here. I had the privilege of seeing her leadership this year because the NAACP Centennial was hosted by the New York City chapter, and that's where I live, and so we are so happy to have you today with us. She's going to share with us about a new initiative called the 880 Campaign for Real Healthcare Reform. If you could share what that is and how you help us advance healthiness and wholeness in our communities, we'd appreciate it. But we're so happy that you're here. Thank you for the great job that you did and that you're doing.
Great. Thank you so much, Dr. Sujay. As I look around this table, my sister and friend on the National Board of Directors of the NAACP has shared that the village is really here. And as we look around, we have individuals and representatives from academia, from education, from faith-based organizations, from labor, from medicine, and from public policy. Because clearly it takes a village to really do something about this healthcare reform problem. My colleague as well talked about public policy. That's why we're here this weekend. And that's what's raging across the length and breadth of this nation. I'm pleased to be joined by my colleagues on the National Board of Directors. To my right, we keep referencing each other because you got to know where your base is. Cleola Brown, to my right, is here from the labor movement. Also, Reverend Teresa Deer from Illinois is here, a member of our National Board of Directors. But we're also pleased that the face of healthcare for the NAACP, we're so pleased that we stole someone from you, Siobhan Arlene, who's been a public health expert, who would be coming on board of the NAACP as our National Health Director. Why don't you welcome her? You want to know who you're going to see. And there's also a dynamic young woman who's passing out some literature for you. She's the Executive Special Assistant for our President and CEO, the Honorable Benjamin Todd Jellis, Ms. Joteka Edie. Want to thank her for being here as well. But very, very quickly, the NAACP is not new to the healthcare reform debate. We've been involved in healthcare issues since 1932 with the Hill-Burton legislation that dealt with restraint of trade for African-American physicians who were refused the ability to exercise their craft in Washington, D.C. and Philadelphia. So we're not Johnny-come-lately to this debate. And it's so critical that when you think about organizations who have 100 years behind them of advocacy and pushing and advocating, I think about the words of Fannie Lou Hamer. Say, we're sick and tired of being sick and tired. But when you get sick and tired of being sick and tired, sisters, what are you going to do? What are you going to do? And I think that's why we're here in this room and we're asking each other the question, what can we do? That's why the NAACP is at the table, aggressively talking about the public policy issues that are so important to us. Because it was stated this morning that the hand that rules the world, the rocks, the cradle rules the world. And those hands are the hands of women. And women across this nation really determine the healthcare outcome of families. And so it's so important that we become very much engaged in this conversation. We are very pleased that very shortly on our website, www.naacp.org, we're launching an initiative that's called the 880 Campaign. And we're asking all of you to partner with us in this regard. And why 880? The American Journal of Public Health shared in a report recently that 880,000 Americans lost their lives because of lack of health care reform over the last decade. 880,000 individuals. And disproportionately, you know who was in that number. Who was it? People that look like you and me, African American women and children. And so we're calling upon the community, the faith community, the labor community, public policy, those in the philanthropic community, to come on board and partner with the NAACP to really do something about accessible and affordable quality health care. But it's just not enough to get to the door. It's not enough to have it financed. And it's not enough to just to have quality. We want to do something about the delivery of health care. We want to talk about cultural competency, and that when you go to a physician, to make sure that they understand your unique needs.
Right.
And what all of the attendant social and economic determinants of health that you bring with you, sisters, when you walk through the door. And so that's why it's so important that we are front and center in this healthcare debate. Think about who was at the tea parties, having a great time.
Come on.
Think about who was raising hell at the town hall meetings. Did any of them look like those of you in this room? Now you say, oh, not one, but then I ask the question, well, where the hell were you?
Come on.
Where were you? Where were your voices in that conversation? I share that with you not to be disrespectful, but to say that we can't rely on anybody to do anything for us that we're not prepared to do for ourselves.
Right.
We all know how lack of healthcare is ravaging our families. Not only those who are outside of our communities and our walls, but also our brothers and our sisters, our uncles and our fathers who are incarcerated behind prison walls. The state of my birth in Florida just incarcerated their 100,000th inmate. 100,000 individuals in the state of Florida are incarcerated. Disproportionately, who do they look like? Those of us who are in this room. And the stress of having our loved ones behind bars, not knowing what's happening to them, and the loss of economic potential to American society is really devastating. And that causes stress on women in this community. So we call upon you, www.naacp.org, to join us in the fight for health care. Since 1980, the NAACP has looked at health care as a civil and a human right that is entitled to all Americans. Despite public persona, propaganda, and maybe public policy, health care is not a black issue or a white issue. It is an American issue,
yes.
And we need to do something about it today. And so, in closing, I leave you the words of the Lion of the Senate when he said, "The work goes on, the cause endures, hope still lives, and the dream of affordable and accessible quality health care for all Americans will never die."
We also said try to find the wrong and right it. And all of these sisters who have shared today are doing that, as well as those in this room who may not have had a mic, but we thank you for your support and the work that you're doing. And we hope that you'll continue to share with us and feed into us the work that you're doing, websites that we need to tap into, information that we need to have. But we are so excited to be joined by another sister congresswoman. As I go to the White House, somebody has to go, I'm sorry. But they need to meet with some clergy leaders, and so we're asking Congresswoman Donna Edwards, who's also one of our hosts today, along with our wonderful leader, Melanie, and certainly our sister president from Bennett College for Women, who has joined us, Dr. Julia Melvo. And so I leave you a very capable sister man. Please pray for me and go through it around. I hope to see you October 27th at lunchtime for 7 Tuesdays. We'll see you then.
Actually, I just came to sit in, and sometimes we get the Donnas confused. There are two of us Donnas, and that means we're really doubly powerful. And I just thank my sister leader, Donna Christensen from the Virgin Islands, for her leadership on healthcare reform. And I want to say I know I share the view of many of our colleagues in the Congressional Black Caucus, the various Tri-Caucus and the Progressive Caucus, in the notion that we must have quality, affordable, accessible health care for all Americans. And that doesn't stop in a doctor's office, that it may be a community health center, that's the delivery system. It may be a school, it may be a workplace. But the fact is that premiums, deductibles, and co-payments are skyrocketing for the 160 million people who do have health care. And for the 47 million people, 14,000 each day by the end of today, another 14,000 people without health care in this country. It is unacceptable. And I believe it really is a moral imperative, but it's actually good business and it's good for our global economy. And so I am committed to working with my colleagues in the Congress, working with all of our leadership, wonderful, powerful leadership, out in the field, calling for quality, affordable, and accessible health care. And I'm just going to put it out right here that I think that by the end of the day, or perhaps next week, not only will we have a health care bill out of the House, then out of the Senate, but it's going to be a good one. And it's going to be one one that recognizes that we have to have a system with competition. We have to have a system where people can access health care. We must have a system in which if you need a doctor, you should go to a doctor. And I'm going to leave you this in closing. And it's the reason that I feel so passionately about why we have to have a healthcare system that works for all of us. Because I can get dressed in my fancy clothes today and my shoes because I love to do that. And I have a great job now in the United States Congress, and we have health care. But not very far away, and not very far away in my mind, is a time just about 15 years ago when I didn't have health care. And when I got sick, I fell out in the middle of a grocery store in my neighborhood. I had to be taken to a hospital in my community. And at that hospital, they didn't ask me whether I had a green card. They didn't ask me whether I had a passport. They didn't ask me whether I had health care, but they treated me. And they treated me in an emergency room for something that I probably could have been treated in a doctor's office for 2 weeks prior to that for about $100. And it ended up costing thousands of dollars. And I ended up almost losing my home as a result of that. And I know that this is not, unfortunately, a unique story. It's my story, but I know that across this country, throughout our congressional districts, there's every single family that has a similar story. It's unacceptable. And so I thank you for your guidance, for your leadership, for your advocacy, and we will get this done for the American people. Thank you very much.
Sister Donna Edwards, Congresswoman Donna Edwards, for some of you who may not be familiar with her, she is one of our champions on the Hill, and a regular champion at that. And I need to tell you that Sister can pull up that picnic table and outeat the rest of you, so don't let that fool you, not at all. But for your vigilant fight that you continue to do, we thank you sincerely for that. It's good to see you this afternoon. Now, if you know Melanie, you must be ever so ready. Okay, all right. So in that role, I want to do something that is actually a pleasure for me to do this afternoon, because to my right, to some of your left, depends on what side of the room you sitting on, so don't say it's my right, my left. I know where you at. All right? The Dr. Julianne Malveaux, who many of you know by name on paper. Some of you know from the many appearances that she's made on Bill Maher. A lot of you know now, since she has achieved such a high position, being a president of the university. But most of you in this room should know through her activist work over the years, and a sister who calls it like it is. I get the opportunity to say to the rest of you, to present just a few remarks this afternoon, one of the most dynamic sisters in leadership in the United States, Dr. Julianne Malveaux.
Everyone.
I actually did not plan to come to speak, but to listen, because there's so many doctors, medical experts sitting around the table that it's really important that I learn from you. But let me bring you greetings from Bennett College for Women, the oasis where we educate and celebrate women and develop them into 21st century leaders and global thinkers. And let me tell you from our perspective how important this healthcare issue is, and how our young women are suffering just as we are because of some of these draconian measures that will prevent people from having health insurance. For example, in about 20 states, being a victim of domestic abuse is one of the ways, that's considered a pre-existing condition. Now, let me tell you a story. There was a Blanche Williams, not here I don't think, but Blanche is doing great work with the National Black Women's Town Hall meeting. 3 years ago when I first came to Bennett in August of 2007, I met a young woman who was very shy. And I asked her, because her shyness was palpable, to read the invitation. That's what we do. We try to bring people out of their shell and put them somewhere. And she said, ma'am, I don't read in public. I said, no. When your president asks you to do something, you do what your president asks you to do. And so she very shy. We read the invitation with her head kind of down. And I brought her, she's now our Student Government Association Vice President, and I brought her to the Black Women's Town Hall as a panelist. I said to Blanche, I'll come if I can bring a student. What this young woman talked about was domestic violence among young women. I mean, that was not what she came to talk about. She came to talk about students, but someone said something that moved her, and she talked about the number of young women who are victims of domestic violence. You know, what I try to tell our girls every day is, if you are cake and men are icing, you can have cake without icing, but you cannot have icing without cake. So, you know, you need to understand that you're enough, and therefore don't make the kind of compromises that we see so many young women making because they want to have a man in their life. Men are like buses, they come. Now they may come slower as you get older. Our young women to have a sense of self, you know. But in any case, yeah, see, y'all read that somewhere. Y'all read it. Oh well. But in any case, the healthcare issue is just such an important issue. We provide healthcare for our students. We pay premiums that are rising. We cover them for the time that they're with us, which is the academic year. For us to cover them over the summer would cost us about 40% more, so we don't do it. But what that means is that a young woman whose parents did not have her covered, if she's over 23 or various other reasons, she will not be covered in the summer. And so we have young people who come back from the summer with more debt because of something that had happened to them over the summer. Some of our athletes, some of our baby athletes, and we try to figure out ways that we can work around it. And as you know, Bennett, as all HBCUs, are fiscally fragile, and so we have to try to figure out what to do. But the point is that our young women are really suffering. If, for the sisters in the house, and the good men if there are some, there may be one or two back there, but in any case, we have to do what we must do to save our girls. Yes. Our young women, I see every day the kind of challenges that they face, and many of them face these challenges because of these issues of access, and also because of those things that visit our community more permanently and earlier than they visit other communities. We have young women who are being diagnosed with breast cancer at 26 and 27 years old. And yet your health insurance will not send you to get a mammogram until you're 40. So we're missing lots of women in that way. And then when we are diagnosed, too late often, we die more quickly from breast cancer. But heart disease, obesity, diabetes, I'm sure we've heard the litany of all of these things. What I must tell you with the obesity is that when you look at our young sisters, walk across my campus, it's challenging. It's literally challenging to see. I tell people all the time, look, if you look like this when you're 22, how do you think you're going to look when you're 42? You know, but what people are doing is feeding their pain. And so, you know, we have fried chicken Wednesday. It's on my nerves, but we have fried chicken Wednesday. And I finally told them, you cannot give people 3 and 4 pieces of chicken. You will give them 2 pieces, make them stand back in line. If you ate 4 pieces of chicken for lunch, do you plan to go to class at 1 o'clock? I don't think so. We talk about healthy eating habits and the ways that we let our young women know that they can be healthy, that they don't have to feed their pain with food, that they can feed it with exercise or with something else. This literally is important. We all know how important it is, or we would not be here. But what we have to be clear about is that these insurance companies are making money. These insurance companies are attempting to preserve a profit center. That's what they're doing right now. The other thing that we must know is the way that the affordability and access to health care deals with all of the rest of our economics. The number one reason that somebody goes bankrupt is because of a health emergency. As Donna described, you should not have health care, so you wait till you get to the emergency room. When you get to the emergency room, it's much more expensive. Plus, furthermore, these hospitals will now track you down and find you and charge you double, triple interest, penalties, all of that. It's almost like dealing with the IRS. And your credit scores, of course, affect your access to employment and to everything else. So this health piece is a linchpin. Now, I happen to think that the jobs piece is equally important, and I'm hoping that once the legislation is passed, the White House will pay some attention to employment and training. Because my personal assertion is all those crazy folks who go to tea parties, they wouldn't do that if they had jobs. They would have time to go to these tea parties and walk around with these crazy signs, you know. Their imagination would have to be remunerated in a different kind of way. So we would know some of them were evil, they'd be out there anyway. But the ones who are not evil, they're just unemployed. And let us be clear how staggering unemployment is in our country. 9.7% overall really means about 16%. That's for everybody. I mean, 1 in 6 Americans is not working. But when we talk about our community, and nobody talks about it, and it infuriates me. It's the only time I miss myself on television is when I turn on the unemployment report and no one says anything about black unemployment. I'm like, oh, come on, y'all. But if it's 9.7 for the overall population, it's 15.7 in our community. But then when you do the calculations on the hidden unemployment, it's 28.7%. That means that nearly 1 in 3 African Americans is not working. How can communities survive? You know, and that survival should not be our issue. Now it should be thriving. But how can we thrive in times like these? So our activist hackles have to be raised at this time. We have to be extraordinarily committed both to supporting this president, but to letting legislators know that we're watching them, that we want a health care bill, that we're not indifferent. I've been disappointed this week that I see Rosalyn Brock here, who of course is the vice chair of the NAACP, and she's probably spoken already, but you know, our civil rights organizations have been late to the party on health care. We have not seen African American people talking about health. We see all these other activists, but let's be clear, healthcare is a civil rights issue. For so very long, we had been sidelined. Doctors would not see us. Now they see us, but indifferently, and they treat us indifferently. The Institutes of Medicine did a study, IOM, JOM, in which it showed that when black people go to the emergency room complaining of pain, they won't give you painkillers because they think you're a drug addict. So you have had African American and Latino men walk out of the emergency rooms with broken bones and no painkillers. But that is how many physicians treat us. But we need to fight that. And so it's my privilege. I really, Melanie has just done such great work in bringing us all together. Very focused. And I want to thank her. I want to thank her for the privilege of just having a few moments to address it.
That is a wonderful note. I wanted that because just like you know, thank Dr. Malvo for her comments as well. And now you get an opportunity to say something. A part of what each of the speakers has said is, well, what are you doing? And Dr. Malvo indicated that, you know, for civil rights community groups, as well as for us, a lot of times we're missing from the party. And that's true. And I'll take a little bit of that to start this discussion, and then I want you just to raise your hands and we'll recognize you with your questions. But when I was introduced, folks heard the initials APRI, and many of you may not know what that stands for. It's the A. Philip Randolph Institute. And it's an organization that was started by A.C. Philip Randolph to raise community awareness and to get some action in our community, and that's what I'm charged to do as its new president. And I've been that now for 4 years, but a part of that is in the last 3 years through the Institute, our focus has been healthcare disparities. Before the last 2 years, where we've started to focus in on the reform. But within that discussion on healthcare disparities, also came a responsibility. What are you going to do? Talk about how bad they treat us? Oh, Lord have mercy, we at the bottom of this and at the bottom of that. No, it's talking about getting up and getting out and taking care of those things that bring about the disparities that are within our community. So with all of the pieces of information that you've gotten around the table this afternoon, if there are questions that are burning in your heart right now, please raise those questions. And I encourage you, I see my sister, yes. Oh, okay. This.
Can you all hear me okay? As I whisper? I'm only going to talk a couple of minutes because my voice really is gone. But two things I need to do. First, as there's a sister here who didn't know I was going to say anything, but I have to say something because it's monumental. And that's Dr. Beverly Wright from New Orleans. who just became a Heinz Foundation, Heinz, this is the Heinz Award, one of 10. She has a good heart to take care of this in cultural environment. Dr. Bob Bullock back there from my alma mater, Clark Atlanta University. And we just have to stop and thank you. And while I'm talking, and it's coming back, is the Black Women's Roundtable members, please stand. So I don't want to have to call the names, I might lose it really quick. All of the women who are part of the Black Women's Roundtable, please stand. So I want to give everyone a hand. The Black Women's Roundtable is. I also want to have the staff to stand up and the team. I'm going to call their names off. Angela Angel, Olivia Scott, Ruby Pulliam, Idria Davis. Felicia don't work for us, but she always had help. So Felicia Davis and Tanya somewhere back there. So I want to make sure I say that. And just make sure you all know this about what's going on. The National Coalition as a women's empowerment component has been the Black Women's Roundtable for a number of years. It started on Gracia Hillman for the reason to make sure Black women had a voice at the power table. 2009, we had to make sure we have a seat at the power table. We turned out the vote. We were the #1 vote. We've been the #1 vote. We love our president. We love this Congress. We have to make sure that we are not, that we're well represented at the table of discussion and dialogue and decision making. And no one's going to give that to us. We have to just be and step to the plate. So part of what we at the National Coalition and the Black Women's Roundtable were mentored by Dr. Dorothy Height in this role, this kind of new role or combined, expanded role that I'm playing with the National Coalition, is to make sure that that vote really means something for our community. That means civic engagement is about making sure that we are healthy, wealthy, and wise. So this is an inaugural of what we're calling the BWR Healthy, Wealthy, and Wise National Policy Forum Series. We will have 2 more coming up, one in November, and we'll get those to you all around economic security. And in early December, we'll have one around education and energy reform. And so we have to make sure our voices are there. And some other great things we're working together around going into community in 2010 with the regional summit. So just stay tuned. And I just want to say thank you, everybody, for being here. We are the ones who are looking forward when it comes to making sure our communities are healthy, wealthy, and wise. So thank you. All right, Q&A.
Okay, Melanie has spoken, so questions from those who are in the room. Okay, I see the sister in the back of the room. Please say your name.
Gwen Thomas from Michigan. I represent Southern Oakland County NAACP. Use the mic. I thought I spoke loud enough. Also, I'm an advocate in my community for a number of different issues, and I'm also writing for the Michigan Chronicle. I wanted to try to get a little more education if I could. I've had a chance to try to review the healthcare issues, the reform, and I live in a community that everybody doesn't look like me. So what I was hoping to come away from today was a little more thorough understanding of some issues. And if you don't mind, if you will indulge me, I just wrote down a few questions. One, there was some some discussion about employers and as it relates to how they might treat employees. So, Congresswoman, is she still here? Are any of the Congress people here? Oh, okay, so if anybody knows the answer. Will there be a cap on any amounts that the employer might ask their employees to contribute? What I mean is, let's just say M Motors decides that you know, the premium that they pay on behalf of their employee, you know, that they pay every month generally amounts to $200 a month, and they say to the employee, you know, we've got to look at being a more leaner operation, and we're going to ask you to contribute $159 or $199 to your health care. Dr. Mobo, do you know anything about that? Can you share any?
Actually, Dr. Johnson is prepared to respond.
Actually, I can probably respond to some of your concerns. And let me first start by saying that on Wednesday, we were fortunate enough that Dr. Christensen and Representative Corrine Brown from Florida co-hosted a forum for African American physicians of color for us to get information from some significant persons, both from the White House administration and other representatives, but also for us to give what we felt about the healthcare reform plan that's being proposed. And the issues you bring up really have been talked about more as it's come out of the Senate bill, the Baucus bill, in terms of it's almost an oxymoron that you would require everyone to have health care, tax the employers if they don't provide health care to their employees if they're above a certain number, whatever that may be, but then also fine the employees if they don't have the coverage. And that is some fairly significant differences from the House bill. The House bill does not have all those provisions in it. The Senate bill is very, very, very heavily favored towards the insurance companies. And to come out with a bill that has no public option in it, but has these co-ops, which are going to be very difficult to engineer and especially to have in our communities, because it takes a very sophisticated population to have it co-op. And give examples of where co-ops are: Minnesota and Seattle, Washington. Okay, those are where the larger co-ops are. So we're talking sophisticated populations, and then the population that has been, totally underserved for the reasons I said before, and others. We just don't have that sophistication to have a co-op. So you're basically putting our communities to have to negotiate with the same people who've been neglecting them for years. That's insurance companies. And so, to answer your question, yes, there are some issues in that Baucus bill in particular related to that. And the answer is, those of you need to talk to your congressperson, communicate with your congressperson and your senators about you wanting a public option. Yesterday we found out at Representative Conyers Forum that there are 40 Democratic congresspersons who signed on saying they aren't signing anything that doesn't have a public option. And that is the difference between a victory or not in the House. And so you must communicate with your congressperson, with your senator. If you know people who live in blue dog states, like South Carolina, Joe Wilson, and others, you need to communicate with them to communicate with those in particular. New England Journal of Medicine, one of the premier medical publications, came out with a study 2 weeks ago that said physicians overwhelmingly support reform and also support the public option. So you must do those things.
So in answer to my question, you're saying that it would make sense for me to express to my congressperson what I've shared to make sure that those kind of things are included in that public option. Did I understand you correctly?
You want a public option because you don't want those who are without insurance to not to be able to get insurance, or to be forced to get insurance from insurance companies who they haven't been able to get insurance from. You want the employer to not to be taxed heavily, and actually in the House bill there are subsidies proposed for up to 400% of the federal poverty limit, which is $88,000 for a family of 4, to help persons obtain insurance if they do not have it. So you want them to one, not fine the employee, because that's what we're concerned about more than the employer, is the employee, not fine the employee for not having coverage if there's no public option available for them. Because it's like I said, it's an oxymoron. It's a double-edged sword.
Okay, and
it's almost a no-win situation.
I had a few more, but I'll reserve them for other people. So will you come back to me if you have a time?
Yes.
I have a couple.
Thanks a lot for being considerate, Felicia. Identify yourself again, please.
I'm sorry. My name is Dr. Beverly Wright. I'm director of the Deep South Center for Environmental Justice at Dillard University in New Orleans, Louisiana. And the majority of my work has been around environmental health, because we're an environmental justice organization fighting for justice. And health is certainly a real part of that. And we work a lot with communities who have been impacted by environmental contaminants. And the stories are numerous, but we have a person here with us today that I'm hoping will, in a very few minutes, tell her own story, and so that you could understand the depth of the kinds of exposures that many women in our community are experiencing, and their entire families at different times are being wiped out. But with the NAACP here as well, I think it's good for you to hear about the discrimination. And everybody's talked a bit about that, how discrimination, when there's no equality, what happens to us. Well, this is a real case, and I would just like my very good friend to very quickly tell her story, and I will yield my time to her.
Pam Tillis, and I'm a former Miss Tennessee bodybuilder. But because I was drinking the 15th most toxic chemical on the planet, I got breast cancer. My father got bone cancer and prostate cancer, and he passed away. This is my second battle with breast cancer. And I was somebody that put all my energy into eating healthy and training not only myself but others. And because of environmental racism, I have had cancer twice. So it is very important for us to consider this. I may know about this, but there's many in this room that look like me that are victims too, whether you know it or not. So I ask you to look around your communities. And if there's a polluting industry, if there's a landfill, I ask ladies that you get your checkups, because I had my very first mammogram I was diagnosed with breast cancer. So this is a very important part of people of color's health, and we have to recognize that. I would also like to see that this healthcare initiative include these communities, and because we are the ones that not only are impacted by these landfills and polluting industry, but we're also the ones that can't afford the health care after we're affected. So it's a very important part of our health care, and thank you for being able. And I'd like to thank the Black Women's Roundtable for allowing this subject, because it's not a hot topic. It's not saving wells. It's racism, and a lot of people don't like to deal with this. So, and the NAACP, we got to do more. So thank you.
Thank you. I just want to, first of all, honor and thank you for sharing, and also thank Melanie for the insight to bring us all together. But one of the benefits of the current administration, you know, the environmental justice work has always been an afterthought, you know, and for the first time, it's actually being integrated into the EPA. And that would never have happened had it not been for the current administration. So some of the things that are taking place we don't hear a lot about, but for the first time, environmental justice is going to be interwoven into regulations. And so this is another thing that we need to be aware of. Other than food and the pollution that's in the food industry, I don't think there's anything that's causing us more premature death than our excess exposure. If you want to predict where a waste dump is housed in this country, it's going to be near a Black community. So we really have to wake up to that tremendous threat. Okay, the sister who's standing, are you standing for? Oh, yeah.
Hi, my name is Cordals McKeever, and I'm the President and CEO of the African American Health Coalition, located in Portland, Oregon. And yes, there are Black people in Portland. As you know, I know you were there recently. The coalition has been addressing health disparities in African Americans for over 20 years, 10 as a volunteer organization and 10 as a nonprofit, as I like to say, long before it became a funding stream. I'll say it again, long before health disparities became a funding stream. And it is a huge funding stream now. And the work is just now beginning. I'm excited that health reform is coming, but I really encourage all of you to stay involved, because it is a funding stream. And with funding streams comes exploitation. You know, just last week there was a $325 million call for prevention, which we've never had in the nation before at that level. And the only people who were qualified to apply were local and state health departments. So we will partner with them, but we really have to stay on top of how the funding is coming down, working with our local legislatures to make sure it gets to the community level where the work is being done. We have over 4,000 people in a free exercise program. They call it, that's what they call it, but it's not free. We pay Parks and Recs almost $100,000 to give it away free, because if you don't value something, you're not willing to pay for it. And we've been doing that for 9 years. And we've been able to keep that program in place 2 years after federal funding is gone. But we need to be able to still access real dollars to give real services to our community. And if it doesn't come at the community level, we cannot do that. Thank you.
Thank you very much, Sister. Ross Brown.
I just want to make a very quick comment. Thank you, Sister, for your story and also for challenging the NAACP. But I just want to share that we have recently will be bringing on somebody to deal with global ecology on our staff. The sister here talked about funding. When Senator Wilson said, "You lie," he was able to raise $2.5 million overnight. And we're in this room talking about 880,000 lives who are being lost. And there is no concomitant response from our community to say, we need you to stay in the fight. And so organizations who are represented around the table, labor, faith communities, civil rights organizations, faith-based communities, nonprofit organizations who are working around healthcare reform, we need your financial resources and we need your voices to come to the table to help us in this regard. We talked about the tea parties, Julianne Melville, and I asked the question, where were you? And a lot of the folks said they were at work, but when we've had meetings, the Urban League has had meetings, Melanie has taken us to the White House and had meetings, and none of you, I'm sure, have ever heard about those meetings that we're talking about and continuing to push the envelope around healthcare reform. We send out on a daily basis through our Washington Bureau the 5 healthcare myths that are happening. We distributed those to you. We also sent you information around the room about healthcare, about the elimination of healthcare disparities. Folks, public policy is the way for us to do something about it, and financing is the way for us to get there. Last point, and then I'm done. This conversation around healthcare is convoluted. When you peel back the onion, it's really about the 2010 midterm elections. The healthcare reform discussion is being bandied around to build momentum, to throw some folk out of office. Yes. Because as President Obama said on the Letterman show, folks just woke up and realized, wow, we got a black man in the White House. And folks are having placards across the country saying, we're taking our children back. Well, we never took them from you. They saw a movement, they were inspired, and they wanted to make a difference in their community. That's what it's about, and we should galvanize around healthcare reform because it's really about our future and our children's future. So after this debate happens, whatever comes out around healthcare reform, we've got to stay at the table because 2010, it's time for us to line up again and go to the voting box to talk about economic ecology, around healthcare reform, and around social and economic determinants of health, but also how this whole racism is continually weaving itself into our society, to the fabric of our society, because some folk want to go back to the good old days. Yes.
Okay, we can take 2 more questions. I see a hand here, and I see a sister making her way to the mic. So if you're going to raise a question, please go to the mic as well.
Okay, thank you so much.
Oh, there is one here?
Yes.
Okay.
Yes. Give me praise and honor to God. My name is Io Handy Kendi. I'm a breathologist. I'm a stress manager. I'm a holistic practitioner. I'm a community organizer. And I really appreciate this forum. You all have said some very serious, important things about health. What I don't hear enough about whenever I go to forums like this is the effects of some of the most simple, basic challenges in our community relative to prevention. drinking more water, managing our stress, deep breathing because we need more increased oxygen. Very simple things that are in the realm of holistic health. So we talk about the allopathic model all the time. How does a practitioner like me, I see miracles happening with helping a person understand some of these simple, basic changes. How does a holistic practitioner get into the dialogue? How do we get back to the concept of laying on of hands, herbology, and nature walks, things of that nature? The determination of spirit, mind, and body, and how important that is to health. How do we get that into legislation?
Okay, well, I'm not sure that she can talk about bush medicine or putting hands on anybody, but I know Barbara Perkins can certainly address some of the issues that you raised, and I do take what you said seriously.
I understand, but...
Sister Perkins, would you?
I didn't get your name, but I so respect what you do.
My name is Io Handy.
And I'll talk with you afterwards,
Yes,
but
ma'am.
I'm sorry, I'll move forward.
Oh, use this one. That one will work better. There we go.
So quickly, I'll just say that I respect so much of what you do because it is the basics. It's going back to the earth. But there are some simple things. We started, I don't know if you were in the room, we started early and I made some remarks about some really simple things we can do and how stress is the thief in our community and how excessive behaviors of all kinds come from these stresses. And so clearly, our time is now that we can interject our beginning into what we see as our end, and our beginning is coming from the earth. So it's the peace, it's the calmness, it's the stillness that we have to go back to, and I won't repeat all that I said in the beginning, but these things are not the things up here and just sort of floating around in a meditative state. It's real. So with every single meal of the day, drink a glass of water. So with every opportunity you have to say no to some of what you know already is too much, say, no, I can't right now. Just look that other person, usually another sister, asking you to do something else. Just look them in the eye and smile and say, I just can't. But let me tell you someone who might be able to, and receive the no. And then be brave enough to say to the sister who's sitting next to you, like I'm going to say to a sister that someone put something in my ear today, someone we love who's working on our behalf so hard. When was the last time you had a checkup? I'm going to say that to her because I love her and I want her to continue the work. So all those little things are important, just as important as this hard work that we do. This writing of the paper, these meetings that we have. You may just have to say, no, I can't do that meeting. But someone else might. I can't go, but I can call. So I respect what you do, and I think it is in the conversation. I think we are willing to also help you.
I'm going to ask Eleanor first, and then Dr. Johnson for our last comment.
I just wanted to answer her question about how do we get that in the health reform bill. Just quickly, one of the things that we have been fighting for in making sure that we get in women's health and health reform, as well as eliminating health disparities, is not to include too many of the specifics related to comprehensive benefits. That's the next fight. And so what you will find is that in this bill and all of the amendments, we have been against some of the specifics around benefits. It will not serve us well for the legislators to decide what benefits are fair. And so for several of the coalitions I work on, in particular the Women's Health and the Health Disparities Coalition, the alternative medicine, and then those cultural components related to medicine, alternative medicine, we're asking that we consider that in the comprehensive benefits package after the reform bill.
Thank you very much. Dr. Johnson is our last speaker. I'm sorry, sisters who want to speak, but we've got to get out of the room. I apologize, Dr. Johnson.
Yes, and thank you so much for recognizing me. First of all, Dr. Christensen pledged to us that the Tri-Caucus has gone on record stating that reform must eliminate disparities. all right? Number 2, at HR 3200, and you can go to thomas.gov. That is where you can find the bill, thomas.gov. Okay. Well, I've done thomas.gov and gotten there. But anyway, and you can pull up the bill. There are provisions in the bill for demonstration projects for complementary and alternative medicine in the bill. So the last thing is, when I am a general internist, solo private practitioner every day. All right, that's what I do. Been doing that for 20 years. And when I see patients and talk to patients, I ask, how much water do you drink? How much sleep do you get? What's your day like? What time do you wake up? What time do you get home in the evening? To gauge what, let's talk about, you don't have time to exercise. Let's talk about how you can work it in your day. What do you eat for breakfast? Half the time, 3/4. I hear I don't eat breakfast. You got to deal with that. But it's how many fruits and vegetables do you eat? So I read that every day. And we have to take, women, you have to take responsibility for your health care. I'm just going to tell you this story. 3 weeks ago, had a patient, didn't have diabetes when I first started seeing her. She was overweight. I said, you gotta lose some weight and develop diabetes. She's got other comorbid illnesses. She's got sarcoidosis and pulmonary hypertension and hypertension. And she didn't lose the weight. And so then she developed glucose intolerance, which means we're between normal and diabetic. And she didn't lose the weight. And then she developed diabetes, but she didn't eat meds, didn't lose the weight. And then I need to put her on medication about 2 months ago. And she didn't take the medicine. And then she called the office. We didn't know that when she called the office. We thought she was taking it and not eating and was getting hypoglycemic. Her blood sugar was dropping. The next day, she landed in a hospital emergency room with a blood sugar of over 1,000. Almost tried to drive herself home. But her co-worker who had diabetes saw something and said, we got to call an ambulance. And she didn't do it because she's being like most of us are. She thinks she's got an S on her chest. She let her sister and her sister's college-age son move in, so to make sure he could stay in school. And she's not taking care of herself. She's taking care of her boyfriend who's terminally ill with cancer and not taking care of herself. Wasn't taking her medicine. And I literally had to sit down in the hospital room and tell her, you had a foot on the banana peel, okay? And you got to do better than this. We've been talking about this for years, but the message is we must do better in terms of taking care of ourselves. And it's more than just medicine. It's more than that. And Dr. Christensen has gone on record with that. Thank you.